If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, is type 2 diabetes life-threatening? Answer by Leanne Heisey. No, but after a lag time of many years in smokers, older patients, and those having diabetic complications, it lowers one's survival. Due to the great majority of people concerned, patients, docs, wrongly think it's just diabetes of the elderly, so the diabetes is badly treated, badly controlled, resulting in premature heart attacks, stroke, kidney failure, blindness, etc. Something we see all the time. These, especially cardiovascular complications, can be life-threatening. Type 2 diabetes need to be taken seriously by both patients and docs. The frightening thing is the fact that at the time of diagnosis many already had serious complications, from Medscape login, accessible for healthcare workers and their students, after a free registration. Urine albumin reflex diabetic kidney damage, absent reflexes diabetic polyneuropathy, absent foot pulses diabetic peripheral arterial disease, blockage of the arteries of the legs, leading to amputations if not well managed. This neglect, according to a 2010 report, resulted in about 10 years loss of life years. See https://www.diabetes.org. UK/RSO. According to this Dutch 2017 paper, sex differences in survival of patients with type 2 diabetes in primary care. Zodiac 50, if no diabetic complications, no cardiovascular disease, survival is almost equal to that of the general population. Relative survival with 95% C for men and women with type 2 diabetes after 10 years in different subgroups. Men, blue diamond; women, red square. BMI, body mass index, CVD, cardiovascular disease. Defined as the absence of albuminuria, neuropathy and diabetic retinopathy, defined as non-smoking patients without a history of CVD and microvascular complications. On survival. In primary care treated patients with T2D, the relative survival of men and women was 12% and 18% lower after 14 years of follow-up compared with age-matched men and women in the general population, respectively. This translates into an overall decrease in median survival of 2.2 years in men and 3.5 years in women with T2D compared with men and women in the general population. It does matter what anti-diabetic meds one is on. From type 2 diabetes, survival rates differ based on diabetic medication. There even is a study showing that diabetics on metformin have a lower mortality rate than non-diabetics. Can people with type 2 diabetes live longer than those without? A comparison of mortality in people initiated with metformin or sulfonylureaminate, PubMed, and CBI. That's why the TAME study, see American Federation for Aging Research, TAME, headed by Dr. Nel Barzilai, is recruiting participants for a long-time study looking into whether the use of metformin in non-diabetics is correlated with a longer life. See Dr. Nir Barzilai on the TAME study. Answer by Wayne Bodolick. Absolutely. Type 2 diabetes mellitus is a condition wherein the body cells do not respond efficiently to insulin. Insulin's job is to transfer glucose from the bloodstream, the body's delivery system, into the body's cells, which need it for fuel. When this doesn't happen as it should, too much glucose gets left behind in the bloodstream. And that is a big problem. Glucose in the bloodstream, which is normal, in and of itself, binds chemically with the hemoglobin in the RBCs, red blood cells. When this happens, called glycation, a sort of chemical byproduct called AGEs, advanced glycation end product, S, is created. These AGEs are a sort of sticky sweet gunk that binds the tissue of the vasculature and organs, smothering them and interfering with their function. This causes all the nasty complications of diabetes. In diabetics, of any type, with high BG, blood glucose, levels, this happens too much. And that's why these complications are so common and severe in those patients. Most diabetics don't die of diabetes, they die of kidney failure, heart disease/heart attack, stroke, complications of CVD and PAD, and many more, all attributable to the underlying diabetes. Well-controlled diabetics can defer and even avoid these complications altogether, but that is very difficult for most. It's even harder for type 2 diabetics than it is for type 1 diabetics, even though, overall, type 1 diabetics live, on average, 20 years shorter lives than otherwise healthy non-diabetics, while type 2 diabetics live, on average, 10 years shorter lives than otherwise healthy non-diabetics. So, yes, type 2 diabetes mellitus is life-threatening. But with good management, it can be controlled to keep the complications at bay. But that does require a lot of effort on the patient's part. Answer by Angelia Griffith. No, Finn, it will not. In fact, in MW type 2 diabetes I am Mr. Ryu disorder BU the patient MHVHD at FR years BFRHW diagnosed. As the patient MWLLHV developed an FTH long-term, debilitating complications linked TTH condition with it knowing it. In addition, in type 2 diabetes I a progressive disorder with it a cure. VR TIM patients MMTBBLT produce insulin RU with WLL at D now, MDHM when you needing insulin injections are pills. Type 2 diabetes I a sneakier condition, it harmful health effects and slowly build FR years until full-blown complications, vision loss, heart disease, foot problems, make it impossible to ignore. Fluid FTNM with the WM set F problems. For instance, people with type 2 diabetes are frequently diagnosed with high blood pressure and D cholesterol LNG with high GH blood sugar. T damaging threesome and lead T progressive thickening of TH arteries and D reduced blood flow, putting the patient T greater risk for a slew of complications including heart disease, stroke, and D nerve damage. If the patient I overweight well, or if he's carrying excess pounds run his middle, he's TB and greater risk at heart disease. Potential chronic complications and coexisting medical conditions make type 2 diabetes challenging to deal with well. T deemed MN that the patient managed TH condition, it just means HNT-TD for the HNT safeguard his health. The first line treatment for diabetes is diet, weight control and physical activity. I have found effective ways to cure diabetes and control your blood sugar level. The good news is that sticking to the plan can help people feel healthy and avoid diabetes and further complications.